When people get new prescriptions, a lot of times they don't look at the list of many times there's a ton of side effects. One woman in Seattle started taking a birth control shot, not knowing all the side effects.
That's right. Health reporter Haley Hernandez is now here to explain how this woman became just one of the less than 1% to develop this life-threatening condition.
Yeah, guys, so while she is the less than 1% who developed this condition, the risk, it is still very small, but it is not limited to one kind of birth control. It's found in the patch, pills, and in this case, the 3-month shot.
Marilyn Whiteman thought losing weight would ease her mysterious shortness of breath in 2009, but it didn't. Then she fainted on the stairs.
First question my doctor asked was, "Are you taking Depo-Provera?" And I'm like, "Yeah." He's like, "Oh, that's it. Really? This is what we're doing?"
He put her on blood thinners, but she was in and out of the hospital until last year when her doctors told her that without surgery, she had a 10% chance of living 5 years.
In a very small fraction, however, patients develop a response to the clot where the clot breaks down. Then you start to develop scar-like plugs that obstruct the vessels and make it harder and harder for the blood to be pumped through the lungs.
In a 6-hour procedure that left this scar, Dr. Mulligan removed 15 clots mixed with scar tissue from Marilyn's lungs. First, he had to raise her oxygen level, lower her temperature and metabolism, stop her heart, and drain her blood.
You work very quickly to expediently tease out these clots that are multi-branched without puncturing the vessel, which is wafer thin.
Marilyn says she wouldn't have taken Depo-Provera if her doctor had told her about the blood clot risk.
So I'm telling my story because I want at least one woman to ask the question when your doctor is trying to give you a new drug. Ask the question, what are the side effects?
So the risk of developing a blood clot, again, is very small. Only 1 in 1,000 women per year who are taking birth control pills will develop one. But according to the National Blood Clot Alliance, birth control pills, they do not cause blood clots, but they do increase a woman's chance of developing a blood clot by about 3 or 4 times. Dr. Mulligan says as long as Marilyn stays on her blood thinners, her clots should not return, and they say that it shouldn't be long until she returns back to normal. But it's been a long road until we got here.
Being open with the doctor, answering the questions honestly, and being in tune with your body. I mean, it's, you know, geez, that's a tough one. Exactly. 1 in 1,000.